Substance use disorder is influenced by a complex set of factors, including brain chemistry and genetics. In addition to brain chemistry, social influences and life events can amplify your child's risk for a substance use disorder. In this lesson, I'll discuss how and why social, psychological, and emotional stressors contribute to substance use disorders. I'll also discuss how and why your children are particularly susceptible to these stressors. A main stressor that often plays a role in substance use disorder is trauma. This includes traumatic events that occur in early childhood or adolescence. We call these adverse childhood experiences or ACEs. Adverse childhood experiences can include emotional, physical, and sexual abuse, neglect, mental illness, bullying, incarceration of a parent, poverty, and household instability that could be caused by having a parent with a substance use problem of their own. Studies suggest that stress caused by harmful childhood experiences and addictive substances act on the same circuits in the brain. These are the parts that control decision-making and mood regulation. Scientific research suggests that changes in these brain pathways make a person more susceptible to the effects of substances that can produce addiction. As a result, adolescents and young adults are more likely to like substances that can produce addiction and to self-medicate unpleasant emotions with them. In addition to adverse childhood experiences, or ACEs, toxic environmental influences likely increase the risk for your child to develop a substance use disorder. These socially toxic environments include being raised by a parent or relative who uses drugs, living in neighborhoods or attending schools with high rates of substance use, easy access to alcohol and other drugs, a lack of parental involvement, and high levels of family conflict. These socially toxic environments can lead to additional stressors, which are more pronounced in certain socioeconomic groups and can include things like economic instability, unstable housing, community violence, and experiences of discrimination and racism. It's important to acknowledge that a child's environment also includes their peers. If your child is having a hard time fitting in because they do things differently from the norm, maybe they have a different way of learning or acting in social situations, this can lead to chronic stress. You and your child should be prepared to talk openly and honestly with treatment providers about peer relationships. Parents can help counter the power of peer pressure by communicating their values and expectations about substance use clearly, consistently, and often. Understanding how these stressors affect your child can also guide you to the right type of professional. For example, if your child has gone through adverse childhood experiences or ACEs, they may need a counselor who specializes in trauma. As for what you can do today to support your child, you can start by encouraging healthy recreational and social activities, opportunities to get involved in their community through volunteering or participation in spiritual groups, and involvement in youth support groups where they can develop stress management and coping skills. Right now, we know you feel like you're lost or in a very dark place. We understand. But there is light at the end of the tunnel. It starts with what you're already doing, seeking the necessary help to address the illness head on.